everybody is requested to please take their seats. So today we are going to hold a very interesting debate. It's the first time in nuclear medicine PSNM history that we are talking on some subject of immense interest to everyone. And here we have got two aspects of our discussion. And one speaker will be talking in favor of the statement, and the other speaker is gonna talk against the statement. So let me introduce the first speaker who will be talking in favor of the debate. But before that, let me introduce you to the subject. The question of the debate is, will hybrid imaging make the conventional imaging obsolete? So the hybrid imaging, it's the time of hybrid imaging and the multimodality imaging. And the point to ponder is like whether these hybrid imaging or the multimodality imaging will make the conventional imaging obsolete. So I request the first speaker and who will be talking in favor of this statement. Will hybrid imaging make conventional imaging obsolete? So I request Dr. Amna Hassan to come on the stage, who's a consultant at the Shaukat Khanum Hospital, Nuclear Medicine Division. So you are allowed to talk on the subject for 5 to 7 minutes. And after that, we will ask the other speaker. So we won't make it a very long discussion.
Assalamu alaikum everybody, and welcome. I would first like to thank the organizers, Dr. Shazia, Dr. Azra, and all the rest of the team for having me here. Because it's a debate, I guess I will address you as Mr. President. Yeah, Janabe Ali.
Mr. Convener.
Mr. Convener. Janabe Ali.
Yes.
ठीक है जी. और ये debate, I'm not a debater. I've never been a debater. So I like audience participation. Maybe हम बीच में audience की तरफ भी जा सकते हैं. So I've been given is, will hybrid imaging make conventional imaging obsolete? I would say it's not a question of will, it's a question of, it's a statement. Hybrid imaging has made conventional imaging obsolete. I could say full stop and I could walk off the stage right now, because I challenge everyone in my esteemed audience and my opponent to also tell me that it has not. Because it's going to be...
He'll be telling after a while.
He will be, inshallah, and I look forward to it. So I want the audience, by a show of hand, to tell me who... No
polls. Right now, you have to talk so give some evidence in favor of your this. You have just endorsed the statement. Endorsing the statement doesn't mean that you have won the debate.
जनाब आली, मैं इसीलिए ऑडियंस के हाथ उठाना चाह रही हूँ क्योंकि ये मेरे स्टेटमेंट मेरी तरफ से कर देंगे. एक सवाल की इजाज़त दीजिए.
सवाल देखिए, पहले तो आप कुछ सबूत पेश करें, उसके बाद फिर हम उनसे पूछेंगे.
मैं तो प्रैक्टिस पूछने लगी हूँ. मैं तो केस, आई एम गोइंग टू बेस द केस ऑन प्रैक्टिस. One question.
Okay, I allow one question.
Thank you.
But that should not be raise of hands or anything, because it would influence the whole debate.
I'm so sorry. I will make a statement.
Okay.
I know for a fact there is no PET scanner in Pakistan. Every scanner in Pakistan is a PET CT. I challenge my worthy opponent as well as the wonderful audience here to raise their hand and say, Pakistan mein, is there a PET scanner? There are all PET CT scanners. You cannot have a PET alone scanner. I trained at an institution which did have a PET scanner, just PET. So I have worked with just PET, and I know the problems that are associated with a PET-only scan. Just to name a few, you see an uptake on a scanner, could be anything. It could be a rib. You've done a PET scan, you've spent a huge amount of money on this scan. You have an uptake, you're going to say, please go get a CT scan, please get an MR. Or if you have a CT scan from before, please bring it in and I'm going to fuse it. And I've done that. At the center that I trained at, they had PET and PET CT. Every PET scan, we would either tell the patient, bring your previous imaging, we will manually fuse it. Or go get a CT scan and we're going to fuse it. So patient's going to come again, patient's going to have another scan. How are you going to ensure that you're fusing it together? That's point one, okay? The next thing is, if we look at history, we all love history, right? How did things evolve? You always have something conventional. You start out with basics. It's the need which dictates. You see, you've got all these wonderful scanners all around the globe, and you find that you need a CT on it. Show of hands ki mujhe ijazat nahi hai, but I know most of you, when you replace a scanner, you will go for a SPECT CT, a gamma, not just a gamma alone. As I was preparing for this debate, I actually thought, what am I going to stand there and say? I was reporting I had a ton of imaging that day, this last Thursday. And I was like, every single scan I pull up, here's a PET scan, for example. You just put this PET up, tell me where the disease is. I challenge everyone in this audience to tell me where the disease is. It's interesting, I was looking for an image. It was right in front of me. So here's a scan, you see the liver, you see the heart, you see everything you're supposed to see. Where is the disease? Here's a close-up, where is the disease? The audience can't participate. You're going to be hard-pressed. Don't give me kidney, we know there's kidney. I have a CT with this. There's retroperitoneal disease in this patient. Without this CT, you would not have been able to say that. So here's a fusion. Here's a thyroid. What's going on? I've got esteemed members, colleagues, we can all guess what's going on. Conventional image, basic image. What is there? Esophagus maybe? So we went ahead, we said, let's do hybrid imaging. We see a little focus, enhancement, thyroid tissue. Here's a nice fused image. No longer is nuclear medicine unclear medicine. It's clear, it's there. We can tell them right away. We don't have to make our reports say, clinical correlation advised. Please get a CT scan. Please get an MRI. You have the answer. Here's a focus. There's uptake. Is it metastatic? Is it malignant? What is it? You have hybrid imaging. It's a hemangioma. Lo and behold, you've given them an answer. Patient can move on. Patient is comfortable. Why waste their time? I see the clock is being looked at. Another conventional basic image. Here's a sentinel lymph node mapping. What's going on? Do a SPECT CT. You've got a node, you've got injection sites, you direct the surgeon. It's a level 1, it's a level 2, it's a level 3. Give a specific report. It's no longer just say what you want to say. You are using resources as they are meant to be. Stop making patients come again and again, increasing their costs. MRIs and CTs are very expensive in Pakistan. Add that on to a bone scan, it doesn't make sense. As I was called for this debate, I actually received an interesting call by my opponent, Dr. Nomer, esteemed colleague. He said, "Ladai na ho jaye udhar."
पहले से मिले हुए हैं। मुझे तो इस पे ये देखें ये नूरा कुश्ती हो रही है।
So ये एक debate है। But Janabe Ali, we will rest the case with you and with the audience to decide. So,
thank you, wonderful. Thank you, Dr. Amna. Please, you have to stay here for a while because the debate will continue.
Absolutely.
Now I request head of the nuclear medicine department or also Dr. Arzu is here. So तो एक और डिबेट मैंने जो शुरू कर दे डॉक्टर आरजू सॉरी ही इज जस्ट अ डिप्टी चीफ मेडिकल ऑफिसर सो आई रिक्वेस्ट सवाल करने की इजाजत है सर सवालात उठाएंगे सर सवालात बहुत उठाएंगे we are yes we have to we have to that was discussed initially and now I request Dr. Numair actually nobody has read I think the whole phrase in detail. Dr. Numair Yunus, please come on the stage. Yeah, you have to take this podium. And he has to talk. Sir, ये अभी आप इस that's the question. Now there are many ifs and buts in the statement. Say. Ji Numair, against. Please.
इसके बाद जो है you are all feeling this tighty and now a bit excited about this whole debate. अच्छा hybrid, what is hybrid? So if you go to the history, hybrid says that it's involving a mixture of work or study conducted in the usual locations. And the interesting thing is that early 17th century says that it is a offspring of or a child of a free man and a slave. So here we are here deciding about the hybrid, and hybrid history goes back to 17th century. So which of these is a slave, the nuclear medicine or the CT? So this is, I think, the debate. If the nuclear medicine images were providing useful information for such a long time, so the strength in all these images, which Dr. Amna has already shown, and I can rest my case by just saying that all those images were actually nuclear medicine based images. So they showed the strength of the radiopharmaceutical concentrating into some pathological or physiological process, and then okay, we have some problem with the radiological correlation. We get a CT and they see there is a retroperitoneal fibrosis. They don't know whether the disease is viable or not. So they still need a PET image or a SPECT image. So anyway, the debate today is now whether do we need conventional nuclear medicine or should we ask our people to start buying only the hybrid machines.
I think the question is conventional imaging, not conventional nuclear medicine.
So we will stick to nuclear medicine because if we go to that, it will become a very long
third debate.
But this is a very important slide. All of you please pay attention to this slide because nuclear medicine is not about imaging alone. So it's about conventional therapy as well. It's about the newly developed radiotheranostics as well. And one of the neglected portion is here, which is, if I can show you here, this is radio guided intervention. We use gamma probes, surgical probes, and it's all guided by the nuclear medicine. The radiation signal coming from a lymph node, you don't need any CT if you are doing a surgery. It's just simply a probe that you need and it will localize the node at all. That's what is required. So the availability of the gamma camera, you can have maybe 10 gamma cameras in this city alone. So how many SPECT CTs? The cost of machine is very high. It's very technically simpler. You just inject a radiopharmaceutical, do the image, and you'll get the answer to most of your queries. And then the cost of the scanning itself. If you go for a SPECT CT, you ask for patient to pay more. And then there is radiation exposure involved, and we'll see how it goes. So I personally believe that the conventional imaging or the conventional nuclear medicine is not being fully utilized to its potential in our CTS or our part of the world. So it's basically the strength of the conventional nuclear medicine, the ability of the radiopharmaceutical to show up a pathological process or a physiological process that is more important. The only thing that we miss on the nuclear medicine images, and we have been, always accepting that truth, that there is poor resolution, there is poor anatomical localization, and there are poor morphological details. So that bit, we just take a radiograph, we put up, and we can see how it is doing. we ask the patient if they have already undergone a CT, just correlate it with the nuclear medicine image and you get your answer. So just to show you, this is a slide shown by Dr. Ahmed Qureshi Saab. I took the liberty to show it here. The SPECT CT right now are only 13 in the country and against 37 SPECT machines or the gamma camera machines that we have. These are the beautiful images we get from the conventional so-called nuclear medicine image. So anyone from the audience wants to comment on this scan? So Dr. Khalid has correctly said widespread metastasis. Anyone wants to say कुछ और करना चाहिए इसमें? Dr. Lubna? कुछ नहीं करना, कोई CT, SPECT CT करा लें, कोई PET CT करा लें, काफ़ी है. ठीक है. अच्छा, so multiple osteoblastic metastasis. This is what we get most of the time in our centers. Why do we need a SPECT CT for this simple study?
DTPA, yes.
What about this one? Anyone?
No need of.
So do we need an ultrasound to correlate with this one? Do we need a CT? Do we need a PET MRI? Do we need a SPECT MRI? I think it's quite straightforward. Just a dynamic renal scan showing you obstruction. And this again, in most of the times, is quite straightforward. Again, it's a diffuse toxic goiter, it's a solitary toxic nodule, it's a toxic multinodular goiter. I think, क्यों अनम कुछ और करना है इसमें? So the only thing we might need it, अनम को मैंने इसलिए पूछा, वो मेरी ट्रेनी है, मेरी तरफ खड़े होगी ना, तो इसलिए I asked her. So anyway, usually the answer is straightforward, and so maybe Dr. Rizwan can comment on that, or probably Dr. Kaisar Siraj Saab. These are your strengths. So do we need a SPECT CT or PET MRI for this one? So it's just severe reversible ischemia in inferior wall, septum and anterior wall.
You have got 1 minute more.
Yeah, so I'm just resting my case. So this is the last image and 2 more slides to go. So this was an octreotide scan and it showed uptake, and here we needed SPECT CT. We did it. करना चाहिए था यहाँ पे या नहीं? चलें, कर लिया हमने. Again, it showed that CT did not show any lesion in the liver part because the lesion was isodense, and the SPECT part showed the pathological uptake. And this is from the literature. You can go to the link and you just find it out. The evidence is there that the SPECT or the nuclear medicine part is rather giving you all the information. The CT people, they were actually, since 1970s, they were wandering here and there and they could not. So that's why there was a need of PET CT and SPECT CT, and the nuclear medicine strength was put into it. The only thing I want to stay here. Thank you very much. So
ट्रेनी बहुत हो गए हैं.
नहीं अभी इन्होंने झगड़ा कराना है.
झगड़ा कराना है, अभी खुश ना हो.
अभी आकिब साहब ने झगड़ा कराना है. So this is just the radiation exposure that if we are using it without CT, if we do a CT, the radiation exposure increases, and if you are using only, not as a whole body CT, but only on a regional basis, even then the radiation exposure is increased. So yes, SPECT CT might be needed in some cases, but not all the cases. Just this last slide, it's a bit crowdy slide, but just look at the figures I have shown in red. This reflects the data from 2012 to 2020 from UK. It's available on the internet, just go and you'll find it. So it says that the nuclear medicine scanning, which includes only planar, dynamic, whole body images, there has been only a decline of -6%. So the number has been around 396,000 over many years. It's around 400,000 scans in a year. The SPECT part includes the SPECT CT as well, and the number has increased from 19,000 to 45,000 in a year. But does that has made the conventional imaging obsolete? I think the conventional imaging has kept its ground. So the SPECT CT or PET CT or SPECT alone, whatever you do, you will still be looking towards the conventional nuclear medicine. Thank you very much. Although, thank you. Thank you. So I think with this picture, maybe some of the sympathies I have gained.
For both the speakers, who spoke in favor of the statement, and for Dr. Numair, you can have a good round of applause. इनके लिए तालियां बजा दें. Now the house is open for discussion, but First of all, let me take a question from Dr. Brigadier Fida Hussain.
Thank you very much. Basically, interesting discussion. The only thing which I want to add, okay, in one way, adding the structural imaging with the functional imaging, it gives a more precision diagnosis in the one way. In another way, previously, SPECT and CT, they were totally different thing. Nuclear medicine and radiology was totally different field. What वो एक स्टोरी हम पढ़ते थे जी, किसी जगह पे एक लीमू निचोड़ था, वो जो भी गुजरता था खाना खोलता था, लीमू निचोड़ता था, शामिल हो जाता था. अब हुआ ये कि वो सीटी डाल के they try to capture the nuclear medicine which is being done in army. So that is a bad thing. Nuclear medicine is a totally different field and radiology is totally different field. Why they are capturing us? Why we can't capture them? Wonderful.
Yeah. So, Dr. Humayun is on the link. So he wants to make a comment. So he is waiting for that. Please, Dr. Humayun. He's watching us from there. Unfortunately. Yes, he is there. Nice to see you, Humayun. आपकी आवाज अभी नहीं आ रही.
Yeah, how can you know?
अभी सिर्फ तस्वीर है, अभी रूह नहीं आई है. आ गई. चलें, please, हुमायूं.
Okay, thank you very much. I'll be very brief. It's a very important and useful discussion, and the arguments from both sides are very valid. The only thing is that conventional imaging will stay there. It's not going anywhere. That's the impression. What is happening in UK, they are putting up simple gamma cameras because they don't have money for a SPECT CT camera. That's a factor you need to understand. In the rest of the world, I keep telling people over here that even developing world is not buying any more simple cameras. I think what will be required will be that the simple non-conventional or conventional SPECT cameras should become more handy to do thyroid and enograms. I think the Germans had some similar smaller cameras, while bigger machines should be hybrid. As far as the argument is concerned, PET-CT is not possible without CT. Many of cardiac also is done with CT over here now. So it's an overlap. One last thing I would say is that I recently had an opportunity to talk to year 1 MBBS trainees about imaging in general. And when I was trying to explain radiology and then trying to explain nuclear medicine, it's different. It was a sea change. It's like talking about where the Pacific Ocean meets the Atlantic Ocean. They'll touch each other, but will they remain separate? Thank you.
Actually, I think Dr. Siraj mentioned, but in a slightly cruel way, that this topic should not be discussed. It should be discussed, but can be modified by saying that, the word which has been used that it will be obsolete, that is not going to happen anyway. Because there are many occasions when we don't need CT. For example, whole myocardial, there are so many other things where really you don't know CT. Yes, we need it for localization in many, many important things, but that does not mean that other is obsolete.
Right. Doctor,
I just
आप मेरे ख्याल में प्रेसिडेंट आखिर में ना बोले, वो तो कदम बोलने की इजाज़त भी नहीं देते. Let the trainees have the younger generation who are in the nuclear medicine specialty, or some are opting for radiology, and they are so. करवानी है. आप एक मिनट पहले इनसे ओपिनियन ले ले, कुछ ओपिनियन बने तो सही ना. लड़ाई कहाँ?
सॉरी, इधर कॉन्फ्लिक्ट ऑफ इंटरेस्ट है. वो ट्रेनीज सारे मेरे अपोनेंट के साथ हैं. हमें ताली से पता चल जाता. बिल्कुल. आप इधर कहीं
मैं किसी और कहीं और से हाँ
नहीं ये सारे
हमारे यहाँ एक और ऐसा भी बंदा है जो न्यूक्लियर मेडिसिन छोड़ के जा चुका है, उनसे बात करते हैं.
ये इन सारे ट्रेनीज का एग्जाम डॉक्टर आमना ने लेना है.
सोच के बोलिएगा.
लेकिन it's a very simple question. Should we discuss on this? How much percentage of conventional is required now in this status, and how much physiological imaging is required in this step? I will just put a simple one question. If you're having the widespread metastatic disease, whatsoever is the primary, will that patient need CT scan or will that patient need PET scan? It's very simple answer. All those people who are reporting the PET scan, there is so much referral of the widespread metastatic disease with the PET scan. I think there is no need for simple at the PET scan. CT is going to answer this your question. When there is a need for PET scan, that is when you are not clear on your conventional imaging, then you need something in the form of PET scan. So I think discussion should be on the percentage of conventional imaging versus on that physiological.
So it's, your point is it's not getting obsolete anyway. So there are a lot of the areas where still conventional nuclear medicine would be available to people in the coming years. आप कुछ कहना चाहेंगे?
I am having very brief question. I'm just asking how many PET only scan you have done until now?
Okay, so if you, no, it doesn't matter. Doesn't matter. In fact, if you go through the guidelines, none of the guidelines require that a PET only scan should be done, right? So all the guidelines, and now I think being a nuclear medicine person, I would say a PET scan. I would not write CT because it is understood that the CT is under the cover of PET. Yeah. So this is my advice to all the nuclear physicians who are practicing PET CT and reporting on it. Just call it a PET scan. The strength is with the PET, not with the CT. So, rightly answering your question, we do PET only, or we interpret PET only when we are dealing with the cardiac, so we don't need the CT component. We just comment on the viability by looking at the PET images. If we are doing PET images for the sarcoidosis and other things, many times you don't need the CT component.
I just want to say something in addition to what you said. He's right. The point is that we cannot not do CT because it's a part of the equipment you have. So for attenuation correction, you cannot do it without the CT. You cannot buy it, it's not your choice. You're already there.
But still there would be a lot of gamma cameras coming without a CT component.
I'm going to finish the PET debate. Let's finish it here. There are no scanners without CT anymore. There used to be. As I said, I've worked on them. But the thing is, that CT image is your responsibility. I'm talking to all the trainees back there. Whether it's a cardiac PET CT, whether you're only using it for attenuation correction, that CT is your responsibility. Each one of you now is a hybrid imaging specialist. If you are reporting PET CT, you call it PET, you call it PET CT. That's just potatoes, whatever. Okay. You got to report that CT. It's all hybrid imaging. So one aspect we can rest, all PET CT is hybrid imaging.
Okay.
Actually, I am going to reiterate what Dr. Amna just said, because Dr. Namer very enthusiastically said that we should just, when we are advising the patient, we should write PET scan. I need to ask him, when we are writing reports, do we say PET report or PET CT? We always say PET CT because it's the era of now hybrid specialty. And you know, not only in Pakistan, this debate is being taken up all over the world. And over there, people are actually trained in both the modalities, nuclear medicine as well as radiology. So it's no longer, you know, just nuclear physicians or radiologists. If you look at it, most of the training courses that are coming up, they are involving both the specialities. Number 2 point I need to make again, because both the people standing on the dais, they showed kind of biased images. Dr. Namer showed a bone scan image that spoke for itself. But then you come across many images where you do need the CT part to characterize and localize the lesion. Similarly, Dr. Amna showed the images that did not need, you know. So I think the statement in itself, obsolete, is the catchy part. The thing is going to be obsolete. They are going to go hand in hand.
देखिए, आपको side pick करनी पड़ेगी. आप दोनों की side नहीं ले सकते.
Okay. Just two questions, 2 comments we are going to take, Dr. Rizwan and Dr. Shazia, and then we will get a raise of hands, and then after that we will decide about what. उसमें 3 options मैं रखूँगा.
नहीं नुमैर जैकेट वापस पहन लो,
सीरियस हो गई है मुख्य से।
जैकेट वापस पहन लो। देखिए आमना, जब मैंने भी शुरू किया था, आई स्टार्टेड विद द पेट्स एंड आई वर्क रियली हार्ड एंड फर्स्ट पेपर दैट केम आउट विद द पेट वाज बेसिकली इट वाज देयर. What you need to understand that nuclear medicine is nuclear medicine, and that comes on top of radiology. I am dual, but you know when you request, like what Numair said, a PET, you are always asking a question, what is the activity? You're not asking what structure. So structure comes secondary. So anything, I didn't have the time and I wanted to ask a question on thyroid. A child who had therapy, and then I did a 1, 2, 3 scan and multiple dots in the lung. I reported as, so I said I will go and have a look at the chest CT. I couldn't find it. The patient again had repeated after 3 months, again similar pattern, went back to look at the CT chest, nothing there. So what does it signify? The metabolic activity oversees the structural imaging in oncology and the otherwise. So nuclear medicine still stays on the top, depending how you are going to perceive that eventually.
डॉक्टर रिजवान, आपने तो मेरी टीम की बात कर दी। आपने जो स्कैन किया और सीटी को आप, you looked at the CT as well. You wanted to make sure there's nothing in the bones. We know tiny metastasis in the lungs may not be apparent on CT. However, if any of that activity had gone on to bone, your dose would have been modified.
No. So I would, yeah, but I could have seen it on the planar and the SPECT images.
You couldn't have been sure without your SPECT CT.
No, ribs and the lung, I should be able to.
Ribs, it was possible one of those was in the
You
ribs.
don't need to answer every comment.
Okay.
Can I add a brief comment here, please?
Who's
Humayun, here.
ये कहाँ से आवाज आ रही है? मैं भूत भी बोल
रहा हूँ। I just have one small point. Dr. Amna raised a very good point. Whatever the equipment, there is no such thing as a non-hybrid trained nuclear medicine physician in 2023. If anybody is, they should change their trade. Every nuclear physician should be able to interpret the CT done with a PET CT or a SPECT CT. Thank you.
डॉक्टर शाजिया, आपकी कमेंट के बाद फिर हम इसको क्लोज करते हैं। Sir.
In debate, actually, always it is looked what is written in the sentence.
Yes.
I think if the sentence is written like this, that the other things will be obsolete, then probably many people will not vote. But we are not denying that CT is not required. We say it is required, but it will not obsolete the other investigations.
So ये तीसरा ऑप्शन रख लेते हैं ना, 4 ऑप्शंस रख लेते हैं। हम तो वैसे भी मल्टीपल चॉइस क्वेश्चंस बना रहे होते हैं। ऑल ऑफ द अबव, नन ऑफ द अबव।
इस डिबेट का जो ये टॉपिक रखा है उसके लिए अगर किसी को वो एग्री नहीं करते तो आई थॉट अबाउट इट एंड देन वी चेंज अ लिटिल बिट, बट उसका ऑब्सोलीट रखना इसलिए ज़रूरी था वरना ये डिबेट बनती नहीं थी। तो फॉर द सेक ऑफ डिबेट वी रोट एंड द अदर टॉपिक हमने ये सोचा कि ये अभी इसलिए नहीं करते कि
अंग्रेजी में बात करें,
जिंदा रह जाए, तो उसके बाद दूसरी में भी कर लेंगे क्योंकि वो ज़रा ज़्यादा कंट्रोवर्शियल था। डॉक्टर हुमायूं से मैं मिली हूँ एशिया ओशियाना में, एंड देयर वाज अ टॉक बाय जीटिंग ली फ्रॉम ऑस्ट्रेलिया, and they were telling about the regulations of theranostic in Australia, and in that एक slide थी और जिसमें she said के in regulation they are going to call the physicians which are trained in theranostic theranosticians. That was the term. And मेरा सवाल ये है कि ये जो हम कहते हैं कि हम 200 बैठे हैं उसमें से कुछ तो हो जाएंगे हाइब्रिड इमेजिंग स्पेशलिस्ट, कुछ थेरानोस्टिशियन 10 से हो जाएंगे और कुछ क्या बन जाएंगे। इतनी सी स्पेशलिटी को, डॉक्टर हुमायूं का एक पेपर भी है, आप सब लोग उसको पढ़ें, कि इतनी सी स्पेशलिटी को हम और डिवाइड कर रहे हैं। वी आर ऑल न्यूक्लियर फिजिशियन एंड वी शुड बी अ प्राउड कम्युनिटी और प्राउड न्यूक्लियर फिजिशियन होने चाहिए। वी शुड नॉट कॉल आवरसेल्फ ये वो, और जो डिपार्टमेंट्स कर रहे हैं दे आर डूइंग फाइन। हम पेशेंट्स के लिए सारी चीज़ें करते हैं ना, डिबेट तो डिबेट के लिए होता है। और आप हमेशा क्वेश्चन पूछते हैं कि होना भी चाहिए, एक हर चीज़ का प्रो एंड कॉन होता है। ये एक समड अप तो यही करेंगे कि लोग क्या कहते हैं, लेकिन मेरा ये ख्याल है कि हाँ,
Thank you.
Physician at the end of the day.
अभी टाइम इज ओवर, आई एम ऑलरेडी प्रेस्ड. अभी आप अपना शो ऑफ हैंड में अपना पॉइंट बता दें. Yes, adding color to it. Thank you. Wonderful. Okay, who is in favor of the for Dr. Amna ने जैसे present किया, who thinks that the hybrid imaging will make the conventional imaging obsolete? Who are in favor of that should raise their hands. सवाल गलत था.
Leading question.
अच्छा, मैं अब दूसरी साइड नाउ. सो ये तो सवाल तो खैर मैंने नहीं बनाया था, मुझे तो फंसाया गया है. तो एंड who thinks that conventional imaging, conventional nuclear medicine will stay there and along with the hybrid imaging? So who is in favor of that? So थोड़ा सा इसमें a bit of a bias we have over here as well. Like most of the audience are nuclear physicians, so one should be proud to be a nuclear physician, but the bias is also there. So let's take this question to the RSP conference. लग पता जाना है. Okay, so thank you the worthy speakers. Yes, yes, shake the elbow. Yes, yes, yes. तो तस्वीर लेनी चाहिए, एक पिक्चर हो जाए. एक पिक्चर आपकी होनी चाहिए. हाँ, दोनों.
पाकिस्तान हारा तो निकले.
Thank you. And thank you everybody for your very vibrant contribution to the discussion. I request Dr. Ahmed Qureshi to present the certificates to the worthy contestants. I request Dr. Amna to collect her certificate of participation in this debate. Sir.
मैं देता हूँ. यहाँ पर बहस तो बड़ी हुई है. उधर आ जाओ सर, ऊपर आ जाओ. नहीं यहाँ सुखे. लेकिन मेरे ख्याल में इन जो ये बातें कर रहे थे उसी के अंदर आंसर भी था. आंसर वाज देयर. दे वर कॉलिंग इट स्पेक्ट सिटी एंड पेट सिटी, जबकि आई एम सॉरी शौकत खानम के वेबसाइट पे बहुत अरसा सिटी पेट लिखा जाता रहा है. पता नहीं अभी तक करेक्ट हुआ या नहीं हुआ. बट द थिंग इज, अभी आप चले इंटरनेशनल लिटरेचर में देख लें, वहाँ पे सिटी पेट अब नहीं लिखा जाता. तो मेरा मतलब है कि इसमें सिटी का रोल रिलेटिवली कम है. इट इज़ देयर, लेकिन रिलेटिवली कम है. एंड वी आर गेटिंग हेल्प फ्रॉम देम. दैट्स इट.
वी आर हेल्पिंग देम. मेरा इख्तिलाफ है इधर.
नहीं, मगर आप जिस साइड पर थी तो आपको ये बाद में दूंगा सर्टिफिकेट. अच्छा
पहले नहीं, लेडीज फर्स्ट. आ जाए. नहीं मैडम.
बॉक्स के बगैर यहाँ से रखें.
Dr. Numair Yunus, it was a Thank you. मैं तो सारी देर खड़ा रहा हूँ.
आपका चूंकि यू आर ऑन द ब्लैक बॉर्डर पे तो आपको इसी नजर आना है